Hi friends, today our topic is acute kidney injury. It is also known as acute renal failure, which is characterized by abrupt deterioration in the kidney function. So, because of acute kidney injury, there is a deterioration in the kidney function, which is manifested by increase in the serum creatinine level. Suppose this is the kidney and these are the nephrons. The nephrons are the structural and functional unit of the kidney. So the blood enters to the uh, renal artery and it enters into the nephrons. So what nephron does, the through afferent arteriole it passes to the glomerulus. This is the glomerulus and it is filtered. So the further there is a tubular reabsorption occurs. So some of the important products are taken up by the tubules and the end product is the urine. Now we will focus on the GFR. So if the glomerular filtration rate, which is also called as GFR, is decreased, so there is an abnormal fluid and electrolyte balance and azotemia. So what is azotemia? The azotemia is the increase in the nitrogenous waste product. So decreased GFR leads to decrease in BP and the increase in the colloid osmotic pressure. In normal kidney, the creatinine is filtered by glomerulus and not absorbed by the tubules. But in case of acute kidney injury or the acute renal failure, the creatinine is not filtered by glomerulus, resulting in increase in serum creatinine levels. Now we will focus on the etiology or the causes of acute kidney injury. So it is divided into three parts. The first one is the pre-renal, the second one is the intrarenal, and the third one is the post-renal. So what pre-renal causes? So there are hypovolemia. So decreased pressure or the decreased volume in the renal artery may cause the acute kidney failure. Decreased cardiac output, uh, the congestive heart failure or the renal liver failure, and in NSAIDs, non-steroidal anti-inflammatory drugs, which causes the vasoconstriction of the afferent arteriole. Uh, so, and the last one is the cyclosporine. There is also one cause. There is if there is a formation of the clot or the blood clot thrombus in the artery. So there is a decrease of supply of blood to the kidney. Because of that also AKI can usually takes place. Now we will focus on the intrarenal part of the causes. The first one is the glomerulonephritis, the inflammation of the glomerulus. The second one is the nephrotic syndrome. So there is the proteinuria because of the many important causes. The nephrotic syndrome occurs. Tubular disease such as acute tubular necrosis. When there is a prolonged ischemia due to the pre-renal causes, so the acute tubular necrosis occur. Interstitial diseases, the interstitial diseases such as ischemia and the infections, and it can occur because of also the nephrotoxins. And fifth one is the vascular disease such as vasculitis. These are the intrarenal causes of the acute kidney injury. Now we will focus on the post-renal causes of acute kidney injury. The first one is the renal stones. The renal stones occur in the ureters through which the urine passes to the bladder. Can also cause the acute kidney injury. The prostate enlargement. There is a prostate gland behind the bladder. So there is a enlargement of the prostate gland due to various causes. The third one is the prostate cancer. The fourth one is the cervical cancer. The fifth one is the bladder cancer, and the sixth one is the UTI, that is the urinary tract infections. Now we will be focus on the diagnosis of the acute kidney injury. So the first one is the blood test, the CBC, the complete blood count, and the BUN, which is the blood urea nitrogen, urine analysis. The third one is the renal ultrasound. The fourth one is the urine PCR. The fifth one is the scan, such as the bladder scan. And the sixth one is the CT-KUB. Now we will focus on the management part of the acute kidney injury. So there is a decrease in the fluid. So we have to start the IV fluids. So, and second one is the stop nephrotoxins. We have to stop the nephrotoxins. Third one is the treat the electrolyte imbalances, and the last one is the dialysis. So dialysis depends on the following factors such as the acidosis, electrolyte imbalance, intoxication, fluid overload, uremic complication. So the dialysis is the last step in the management of the acute kidney injury. Thank you guys.